My name is Sabatino Ciatti. I'm a native of New Jersey. I matriculated to Robert Wood Johnson Medical School and completed my medical degree and went on to a dermatology residency at Thomas Jefferson University in Philadelphia. After completing my dermatology residency in Philadelphia, I went on to a Mohs Fellowship where I received my Mohs training and also training in reconstructive techniques. So I chose dermatology because of the many different facets that it incorporated. There was general dermatology, there was surgical dermatology, cosmetic dermatology, and research. I always loved working with my hands, and so from the outset, I really became very interested in doing the surgical procedures and the cosmetic procedures. And as a result, I became very adept at it and was able to get a Mohs Fellowship. And a Mohs Fellowship is really the highest honor you can get in dermatology if you're surgically oriented. It's usually a one-year fellowship where you concentrate primarily on skin cancer, removing them, and for most fellowships, reconstructing them. Now, not all fellowships are the same, but I was very fortunate to have somebody who is just as passionate as I was in terms of reconstruction. And really, when I judge myself on what I do, it's nice to remove the skin cancers. It's obviously, from a medical standpoint, the most important thing, but patients aren't really that worried about the skin cancer sometimes. The first question I usually get is, what's it going to look like, doc? And that's where the reconstruction becomes very important. It's easy for many surgeons to remove something. It's much more difficult for surgeons to put something back together and put it back together in a way that most other people can't notice what was done. By my nature, I'm a perfectionist. I will do whatever it takes to get that to look as perfect as possible. And truly, the most rewarding part of my specialty is when patients come back and tell me, Doc, I can't believe you were able to take that 2-centimeter hole on my nose and I can't even tell where it is. And I've shown it to my friends and they're not sure where it is. And an even bigger compliment is when they refer patients to me, their friends or their family, to have the same procedure done. When a patient comes to my office, the first thing that I try to do is make them feel at home and make them feel comfortable. I think, with a diagnosis of skin cancer or any cancer, the minute somebody hears the word cancer, they are very agitated and freaked out and worried about what the end result will be, particularly if the skin cancer is on the face, in which case there's not only this fear of the skin cancer, but there's the fear of what they're going to look like. I assess every patient differently in terms of where their skin cancer is, what the size of the skin cancer is, and how we can bring it back together once the skin cancer is removed. And throughout the whole thing, I get to have a conversation with patients and they get to give me their input and I give them my input. The nice thing about doing procedures when patients are awake is that you can make them feel comfortable, you can keep them in the dialogue, and you can make them understand why you're doing certain things. The most important thing with the surgeries is to get the skin cancer out. That's the Mohs procedure. The other important part is to reconstruct it. And you want to use a reconstruction that is good for a particular patient. None of this is cookbook. Everybody's skin cancer is different, everybody's defect is different, and everybody's healing characteristics are different. So all those things are taken into account. And depending on what the final result is in 2 to 3 months, if anything else is necessary, we will address that with either a laser or a revisionary procedure.